I think people sometimes don't realize what a care center and nursing home is. There's this stigma about it, that it's dark, it's depressing. It's anything but that. The life that we have here at our care center needs to be experienced. We have residents here from all facets of life. We have residents that come here just for short term. Maybe they've had a surgery at the hospital or they've suffered a stroke and they're looking to get back home and just need some rehabilitation to get there. We're here for that. We're here to celebrate with them when they are able to return home.
Becky Diner sat upstairs in her bedroom and looked at the tree.
We also have residents that come here to live, that this is going to be their permanent home. And that can be an anxious time for them too. So we're here to walk along with them. And there's nothing more exciting than seeing the first time that they show up at a bingo or at a church service, or you see them laughing and socializing with their table mates. Those are fantastic moments, and when their families can tell us they think this is home now, this is their home, those are things that we truly enjoy.
There was a friend of mine who said, "Oh, you're really going to like it. We moved my dad from out of state here because we knew the care would be so much better," and it was. I mean, she said that he was not getting very good care and they were afraid and they wanted to have better quality of care for him. And so they were well pleased. And that was my feeling of, okay, this is going to be okay for Mom.
My mother-in-law, Phyllis Whitney, has been here since 2015. She had broken her hip, couldn't go back to the assisted living place, and her adjustment here went really quickly and the staff was super. I've been to other facilities, several of them, and I haven't seen anything like I've seen here at Staples. There's always plenty of staff to take care of whatever needs he has. Things are clean and neat, and it's been really good.
I love working with the residents, and honestly I love working with their families too, just because I feel that you do make those relationships kind of lasting, and you make them important, and you make them feel important. And you know, I think that I adopt a lot of these people as my foster grandparents, but it's pretty wonderful. I love my job.
One thing that I noticed is when I walked in, it was like a friendly environment. People would be saying hi and welcoming, and it seemed like I was part of the team rather than them just taking care of my mom.
The residents enjoy the different activities like woodworking, and we had a car show. It gives them something to look forward to. And I think it also kind of brings in their families more, and so they look forward to having more of that family time, because with the activities, we like to involve the families and encourage them to participate.
One of the things that makes Lakewood Health Systems Care Center so wonderful is that there is such a breadth of activity and socialization that happens here. We have so many different opportunities for the introvert that just likes to do puzzles. There's a puzzle room, to the extrovert that really wants to stay active, you know, exercise class every day. So I think that there's a little something for everyone here.
The food service here at the Care Center, I think, is top-notch. So we have what's called Susie Q carts, and all the food is on the carts. The food service employee will push the cart table to table, and they will have a sample plate of the meal that is being provided, so the resident can see the meal and they can choose what amount they want, and it's based on their wants at the time. We also have an a la carte menu, so if they don't like what's being served as the main entree, they can choose a meal off of the a la carte.
A-T-T-A-C-K, Cardinals!
Here at the Care Center, we offer something called the Care Conference, and that is a meeting of sorts that we have about every 3 months, quarterly, and then initially when our patients come in, about 2 weeks after they do. And we meet with all different departments here, so it's going to be nursing, social services, activities, dietary, and then we're going to have a nurse's aide come in as well because they're on the wings working with the residents firsthand, so they have that firsthand experience. And then of course the residents and their families, if they choose to come, or they can call in, whatever it is. And this is where we actually sit and talk about how everything's going.
People often ask me, how can you work where you work? Or why do you do what you do? My answer is, there is so much life happening at our care center. How can you not want to do that? And it's the right thing to do.